Have you ever felt like you're on an emotional roller coaster? One moment you are just on top of the world, full of energy, getting everything done, and the next you feel totally drained, hopeless, like you're stuck in mud. It's a feeling a lot of us have, but when those shifts get really extreme and start disrupting your life, well, it might be more than just a bad day. So let's get into it and explore what's really going on.
And this is really the heart of what we're talking about today. It's all about moving from that state of confusion where these intense feelings seem to come out of nowhere and getting to a place of understanding, of balance, and, a bit of control. It's about finding solid ground again.
Yeah, that roller coaster feeling, it's a lot. And in this crazy, fast-paced world we live in, it's so easy to just write it off as stress or, oh, I'm just having mood swings. But what we're talking about here is something deeper. It's about these really dramatic highs and lows that go way beyond the normal ups and downs and start to really impact your life. So, how do you even know when it's something more, when it might be time to look for some support? Well, the good news is you're not just guessing in the dark. These overwhelming feelings, they often show up as some pretty clear, recognizable signs. Let's take a look at what those key indicators are.
When you look at this list, you can start to see it's not about just one thing, right? It's a pattern. We're not talking about one bad night of sleep or, one shopping spree. This is about huge mood shifts that can last for days or even weeks. You might have these periods of just intense, buzzing energy that can lead to impulsive, maybe even risky decisions. And then that's followed by long stretches of deep sadness and zero motivation. And the real kicker is that these patterns start to mess with your daily life, your job, your relationships, just keeping a simple routine.
Okay, another really crucial thing to get is that bipolar disorder isn't just one single thing. It's not a one-size-fits-all diagnosis. It actually exists on a spectrum, and figuring out the specific type is a super important first step toward getting the right kind of support for you.
So let's break this down. This table makes it pretty clear. With bipolar 1, the big defining feature is having at least one severe manic episode. Now, bipolar 2, on the other hand, involves less intense highs, they're called hypomania, but it often comes with longer, more difficult periods of depression. Then you have cyclothymic disorder, which is more of a chronic thing, with milder but more frequent ups and downs. And rapid cycling? Well, that's just what it sounds like. 4 or more mood episodes all within a single year. Seeing them side by side like this really helps make sense of the differences. Okay, so we've talked about the signs, we've talked about the different types. Now let's shift gears to the most important part, the path forward. And I really want to emphasize this. It's a hopeful one. Finding your balance is absolutely 100% possible with a structured, personalized approach to treatment. And this journey is all about you. It's totally tailored to what you need. It all kicks off with a really thorough evaluation to get the complete picture. From there, it's usually a team effort, a combination of medication to help stabilize your moods and therapy to build those crucial coping skills. Then there's routine monitoring, which is key to catching any warning signs early. And just as important, bringing your family into the loop. Educating them helps build an amazing support system. It's really a whole-person plan. Let's zoom in on therapy for a sec. One of the most powerful tools out there is cognitive behavioral therapy, or CBT. What makes CBT so effective is that it's not just about talking about your problems, it's about learning practical skills. It literally gives you a toolkit to help you recognize the thought patterns that can trigger those mood shifts, and then it gives you real, concrete strategies to manage them. It's incredibly empowering for long-term stability. Of course, when you're facing something like this, you're going to have questions, a ton of them, and they are all completely valid. So in this next part, we're going to tackle some of the most common concerns head-on and give you some clear, straight-up answers.
Okay, this is the big one, right? This is probably the number one question people have. We kind of touched on it before, but it is so important it deserves its own spotlight. How do you actually tell the difference?
Looking at this comparison, it becomes crystal clear. It really boils down to 3 things: intensity, duration, and impact. Regular mood swings, they're milder, and they're usually gone pretty quickly. Bipolar episodes, though, are way more intense. They stick around for days or even weeks. But the most critical piece of the puzzle is this: they interfere with your ability to function. That right there, that interference with your life is the key difference. This is another huge question. It's one that gets right to the heart of what people are afraid of for their future. Is a full, happy, productive life still on the table?
Absolutely. Let me say that again. Absolutely. The answer is 1,000% yes. A diagnosis does not define who you are or what you can achieve. With the right, consistent treatment, so many people with bipolar disorder lead amazing careers, they build strong families, and they have incredibly fulfilling lives. It is entirely possible.
And please, remember this. You are so not alone. This is a treatable medical condition, just like diabetes or asthma. It affects tons of successful, high-functioning adults from every walk of life. There's a real, science-backed path to getting help.
So, what's the big picture here? The goal isn't just to manage a condition or to get by. The goal is to find stability so that you can live a rich, full, and meaningful life. And the way to get there isn't some generic off-the-shelf plan. It's a journey that is carefully and thoughtfully designed just for you.
So, I want to leave you with this one thought. After everything we've looked at today, from the signs to the different types to the real, hopeful path to balance, it all comes down to this one simple, powerful question. If any of this felt familiar to you, what could your very first step toward finding that stability be?